Anxiety is a universal human experience that includes feelings of apprehension, uneasiness, uncertainty, or dread resulting from a real or perceived threat. Fear is a reaction to a specific danger, whereas anxiety is a vague sense of dread to specific or unknown danger. Everyone experiences feelings of mild anxiety due to situations that occur in their daily lives, such as an upcoming exam, job interview, sports competition, or other type of performance. However, individuals with anxiety disorders experience more than temporary worry or fear. The anxiety can worsen over time, and symptoms interfere with their daily functioning. People experiencing moderate to severe anxiety may also have objective symptoms such as an elevated heart rate, respiratory rate, or blood pressure. There are several types of anxiety disorders, including generalized anxiety disorder, panic disorder, and phobia-related disorders. Generalized anxiety disorder, GAD. People with GAD have excessive anxiety and worry about numerous events or activities, such as work or school performance. The individual finds it difficult to control their anxiety and worry, and it is associated with symptoms such as restlessness, becoming easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbances. These symptoms impact daily functioning. Panic disorder. People with panic disorder have recurrent panic attacks. Panic attacks are sudden periods of intense fear that come on quickly and reach their peak within minutes. Attacks can occur unexpectedly or can be brought on by a trigger, such as a feared object or situation. People experiencing a panic attack may exhibit symptoms such as sweating, trembling, shortness of breath, chest pain, nausea, increased heart rate, or feelings of losing control. Phobia. A phobia is an intense fear of specific objects or situations, such as flying, heights, or spiders. Arachnophobia, fear of spiders, is a common phobia. Agoraphobia is an intense fear of being in open spaces, a crowd, or outside of one's home alone. People with agoraphobia often avoid these situations because they fear having a panic attack and, as a result, may become homebound. Social anxiety disorder is a type of phobia that includes fear or anxiety about social situations where there is possible scrutiny by others.